From CareCredit, it's Care Experts, a podcast where we dive deep into the health and wellness industry with the professionals that make it happen. I'm Erin Treloar. Nearsightedness, or myopia, might seem pretty straightforward. You can't see far away, so you get glasses. But the truth is, myopia is more common than ever. In fact, 1 in 4 people get it, and that number is only growing, especially in kids. Which is why today we're digging into how to manage myopia for clearer, more comfortable vision now and in the future. Joining us today is Dr. Rupa Wong, a board-certified ophthalmologist, fellowship-trained in pediatric ophthalmology, a Harvard-trained surgeon, and go-to expert when it comes to eye health. You may know her from YouTube or Instagram at Dr. Rupa Wong, where she breaks down everything from screen time to surgery in a way that's actually easy to understand. Today, she's helping us understand what causes myopia, how to treat it, and what you can do to protect your vision over time. I'm so thrilled to be sitting here with Dr. Rupa Wong today to talk all about myopia. I thought we would kick off this conversation. I can only imagine that as an eye health expert, you probably see some pretty funny, quirky habits that people have. What's the most common eye care mistake that people make?
So I'll say 2, actually, okay. And they're both pertaining to contact lenses because there are a lot of contact lens wearers out there. A lot of people who are myopic or nearsighted wear contact lenses. Number one quirky thing I see them do is sleep in their contact lenses, which is so terrible for the eye because when you are sleeping, you're actually increasing the risk of infection to the cornea up to 8 times. So it's not anything, and we all do it, especially I think for college age kids or people that are studying in graduate school or even high school. You're studying, you fall asleep, you're just too tired to take out your contact lenses. Yes. You wake up the next morning and they feel so stuck on. That stuck on feeling, that whole time, you are depriving the front surface of your eye of oxygen. So it's not something you want to do.
Okay, we're taking our contacts off after the end of the day before we go to sleep.
Yes.
You mentioned that you had 2 quirky things.
And also with the contact lenses. Yeah. You should wash your hands before you touch your contacts. I've literally been standing next to people socially who I'm friends with.
Yes.
And know that we're eye doctors, my husband and I, and I'll just see them either spit, take out there because their contacts feel dry. They take it out and put spit on there and put it back in, or just, grabbing them. And, they're at the beach. There's sunscreen on their hands. There's all sorts of things on their hands. Well, you always are really supposed to wash your hands before touching your contact lens.
That makes so much sense. Thank you for the reminder. Everyone, wash your hands before you touch your contacts. All right, let's dive into our topic for today, which is myopia. I was shocked to find that 1/3 of children in the U.S. are being diagnosed with myopia. What is it?
So myopia is nearsightedness, and the statistic is by 2050, half of the world's population is going to be nearsighted or myopic. So it's something that a lot of times doesn't get the attention it deserves because people think, oh, it's just needing glasses, or contact lenses, not a big deal. But it actually has very real potential consequences for the health of your eye long term. So it's something that we're starting to address, and I'm glad that we finally can.
Why do you think that the amount or rates of myopia are raising so quickly?
So a lot of different factors. Of course, nearsightedness, genetics, but that's not changed, right?
Okay.
From 50 years ago to now, your parents are nearsighted, you're nearsighted. But what has changed is the amount of time that kids are spending on near work. So near work is anything you're doing up close. It could be a device, it could be your phone or your laptop or your computer, but it also could just be studying or reading. And we're seeing a real increase in the amount of time kids are spending either on their devices or studying. And they even found in a study when they looked at 2020 with all the digital distance learning that had to be done because of the pandemic, we saw a sharp increase in nearsightedness, and that's been published. They saw a 3 times increase in nearsightedness in kids that were age 6 years old.
Wow.
And a 1.5 times increase in kids 8 to 10 years old because they were on devices much earlier and for longer periods of time than they needed to be. And they're just not getting outside. And we know that being outdoors is protective.
Why is this something that is increasing so much in children? I mean, having nearsightedness or needing glasses as you get older is kind of it's something that's been around forever. But what you're talking about is an increase in youth who are experiencing myopia.
So there's a couple different reasons for needing glasses. So nearsightedness is when you can see things up close or near,
Yes.
but need glasses to see things far away. So also called myopia. Then there's astigmatism, which has to do with the shape of the front surface of your eye. There's even farsightedness, which these are all kind of misnomers because it doesn't make a lot of sense. Some kids who are farsighted actually have trouble seeing near and far. And then there's what I have. Once you're after the age of 40, 45, you need reading glasses to see up close. And that's called presbyopia. So nearsightedness typically affects kids. You don't see presbyopia in children. And presbyopia has to do with how the lens changes shape. As you get older, the lens just doesn't change shape as well. It loses that elasticity like a lot of other things with age, unfortunately. So you don't see that in children. But you do see typically 80% of the glasses that we do for kids are going to be for nearsightedness. So that part makes sense. It's just all the modifiable lifestyle factors, the lack of outdoor time, the increase in near work that we're seeing that's causing this rise in nearsightedness in kids.
What are the signs that we should be looking out for as parents or caregivers that might give clues that our child is struggling with myopia?
And here's the thing. It's such a good question because a lot of people say, oh, my kid didn't complain of having blurred vision.
Yeah.
Well, kids don't know what they're supposed to be seeing. If they've only seen what is normal to them, how do they know that you're supposed to be able to see individual leaves on a tree? I remember my college roommate said, oh, I got glasses for the first time. I never realized trees were supposed to be in such detail. But to look out for if they are moving up close to the TV. Now, that's not always going to be a sign of nearsightedness because some kids just want to be involved in the TV and like right there in front and center. But it could be if they have trouble seeing the board in the classroom. I don't see blackboard anymore because now they all have smart boards, or the dry erase boards. They might have headaches or they might be squinting or rubbing the eyes because they're almost trying to clear the vision, but they can't. So there's a couple different things, even head tilts or head posturing is something else to look out for. But oftentimes the pediatrician is going to check it. They should be checking the vision at every well child visit.
Okay.
And so if the pediatrician finds that your child did not pass the vision screen, then it's time to see an eye doctor.
That was going to be one of my next questions. Are the screenings that kids go through looking for myopia? Is that one of the things they're checking for?
They're not looking specifically for myopia. What they're looking for is just, can you get down to 20/20 vision in each eye? But it can pick up a bunch of different reasons to fail the vision screen. So it's just a screen. The whole point is sometimes I get a lot of patients that fail the vision screen at the pediatricians or, some Lions Club came into the school and did a free vision screen and they're perfect 20/20 in the office. That's fine because we're trying to just make sure we don't miss anybody. So sometimes we're going to get some kids in the pipeline that don't actually need glasses.
So if you're starting to guess that your child might be struggling with myopia, what would the first step be? Are you taking them to a doctor, an optometrist, an ophthalmologist?
If you think your child has myopia or nearsightedness, you could see an optometrist or a pediatric ophthalmologist for glasses. That's something that can be addressed by either one of those eye professions.
Amazing. And what are the treatments for this? Glasses?
So glasses are the treatment, but here's the interesting thing. So if you wear glasses or someone in the audience wears glasses, you probably remember when you got your glasses, your first pair when you were young, you go back, every year it got worse and worse and worse. And we used to not be able to say what could help prevent it from getting worse. Like we just said, well, I'm sorry, that's just kind of what happens. That's the natural progression of the disease because that's really what it is. It's a disease. But now there are different treatment modalities that can help slow that worsening of the nearsightedness. So that's really exciting because it's important from an eye health perspective. I tell people, I don't care how thick your glasses are. I mean, of course, cosmetically, it's important for parents especially, and sometimes for teenagers, right? They don't want really thick glasses. But what I'm most interested in is preventing any future eye health problems. So if you're nearsighted, especially if you're highly nearsighted, you're at increased risk for cataracts, glaucoma, myopic maculopathy, retinal detachments. All of these are at increased risk. And the reason for that is someone who's nearsighted, their eye is longer than the average non-nearsighted eye.
Okay.
So think of it like a balloon that you're inflating with a little bit more air.
Yeah.
That balloon gets stretched a little more thin. So that can cause thinning of the retina, which can lead to breaks or tears. That leads to myopic maculopathy, leads to all of those vision-threatening consequences that I talked about.
I can only imagine that being a parent, we're already worried about 1,000 different things. You take your child in, you think they might need glasses. You find out they've got myopia and they're at risk of all of these different things down the road. Of course, you're going to be wondering, what is the best solution? Can we reverse this? Is it fixable? I mean, you're going to have a million questions. So talk me through a little bit about what you would share as an ophthalmologist.
So I always want to make sure that parents now know there are treatments that can slow this worsening.
Okay.
That can't reverse it, but we can slow it, because once the eyeball is longer, we can't shrink the eyeball, but we can really just start to halt that worsening, that elongation of the eye. So there are special eye drops called low-dose atropine. Atropine is a drop that dilates the pupil of the eye, makes the pupil big. Usually when you go buy it at the drugstore just with a prescription, it will make the pupil big for a whole week. And what they found is if you specially mix the eye drop and dilute it, that can slow the worsening of nearsightedness if you do it in children every night. There are special glasses and even special contact lenses, all that can slow that worsening of nearsightedness. So it's really exciting to finally be able to offer this to parents, because I want every parent to know that these options exist.
Amazing.
And here's the other thing, because a lot of these parents typically are nearsighted themselves, right? So some of them have had LASIK, and there's this misconception that once you've had LASIK, you're not nearsighted anymore. LASIK is just kind of shaving the front surface of the eye, shaving your cornea, so the light now is able to get centered right on the retina. But you still have a nearsighted eyeball. I mean, your eyeball is still longer than normal. You're still at increased risk for all those things that I talked about. So LASIK doesn't decrease the risk of retinal detachments or tears or myopic maculopathy. Making sure your eyeball doesn't get that long in the first place does. So that's where it's exciting, because we have something that can potentially help in the future. And I think it's so interesting that now it's really being incorporated in all of our technology. I don't know if you've ever seen with the iPhone or iPad, it'll tell you, it's got the setting. You're too close. Move it further away. That's why.
There's so many ways that we can be using our devices to support us.
Yes.
And I love that it's even stretching as far as eye health and eye care.
Absolutely.
So it sounds to me like with myopia, the first thing that we want to focus on is preventing it in general, because it cannot be reversed. There is a genetic component to it, but then also the actions that we're taking day in and day out of our life and the amount of near work that we're doing can actually perpetuate myopia in developing earlier.
Absolutely. And you really have to understand too, being outdoors, they've done so many studies. Just 2 hours a day of outdoor time has been shown to be beneficial in different populations, in different studies all across the world, different ethnicities, to slowing that nearsightedness down. Even it negates the effect of the genetics.
Wow.
So, and you don't have to be doing anything specific. It's not like being physically active. It has nothing to do with playing a sport outside and being off of your phone, which was the thought initially. But then they did another study where they looked at kids that were playing indoor sports versus just being outdoor sports. So it's really the outdoor light, which is protective.
Wow. Okay. So making sure that our kiddos are getting some time outdoors. And for anybody listening, we know that there are just a plethora of benefits to this. You mentioned that myopia is a disease, which is interesting to me. Can you speak a little bit more as to how it would be classified as a disease versus something else?
So it's a disease because it has these potential vision-threatening consequences. Myopic maculopathy is at increased risk in people that are highly nearsighted, as is retinal detachments. The retina changes. The retina, the camera film of the eye, though, I feel like younger people don't even know what camera film is like. So it's really hard for me to come up with an analogy for them. But it really does make a difference in that regard. So that's important.
So if somebody does have myopia, then we're looking at either the contact lenses, which are called
MySight.
MySight. Okay. Can you tell me a little bit about the glasses for myopia and what type of glasses people should be looking for?
So traditional glasses is still really what most parents are getting for their children, which is totally fine. You cannot have kids that are just blurred all the time. So I certainly don't think that you have to only go with the special glasses that you can buy in Europe or in Asia that help slow the worsening of nearsightedness. If you have access to that, that's wonderful. But I still recommend glasses because kids need to see in school. They need to be able to see to play sports and do the things. So traditional glasses are still a really great treatment strategy. And then you can just offset it again by watching how much time that they are spending up close, getting them outdoors. It's going to do a lot of the same things to prevent the worsening.
Amazing. And then we have the drops, which would be applied every day. And then the last piece that you mentioned was LASIK. Is LASIK something that kids can do?
No. So you cannot have LASIK until you are at least 18 years old. Generally, LASIK surgeons really want you to be in your 20s because we need to see stable measurements of your glasses prescription, meaning it's not changing for at least 2 years. And your eye's still growing even at 18, 19, 20, especially if you're in college or in grad school and you're doing a lot of reading. I will see my patients still get worse and worse. So we want stable measurements because they're titrating and creating the surgical plan based on your glasses prescription. And if that's constantly changing, they're trying to hit a moving target. So that's not something that you want to do.
Okay, so as you get older, LASIK becomes an option, but as you mentioned, it's still not changing the shape of the eye. So you might be looking at other protective measures as well.
Exactly. So LASIK changes the shape of the front surface of the eye, but not of the eyeball itself. So we do really want to start incorporating these other measures. Plus, there's certain criteria for LASIK. If you're really, really nearsighted, you're not a LASIK or a PRK candidate because they have to shave so much of your cornea off, they can't focus the light properly. So there's different ways where even using these drops or the contact lenses or the special glasses when you are young will at least allow you to be a candidate for LASIK. I have patients whose parents are minus 13, minus 15 diopter of nearsightedness, which is a lot.
Wow. So I'm hearing that while there are increasing amounts of myopia, 1/3 of children moving up to 50% of youth in America, that there are a lot of things that we can do to slow the progression of it so that the disease doesn't become terrible when you're an adult. I am just imagining a mom or a dad or a caregiver listening to this whose child has been diagnosed with this. What would you want to tell them?
Well, first, it doesn't need to be scary because I think there's a lot of anxiety, honestly, from the part of the parents that then gets translated to the kids. So I think don't make it a big deal because then the child's going to get scared. They're going to get nervous about wearing glasses. Sometimes there's a lot of reticence from the parent perspective. I don't want my kid to wear glasses. Sometimes in certain cultures, they don't want that. So I try to just make it as easy as possible for the child to accept the diagnosis. So knowing that a little bit of nearsightedness in and of itself is not dangerous for the eye, and then just knowing that there are treatment options available now.
Yes, amazing. What would you say are 1 or 2 things that parents can do right off the bat to prevent myopia?
The 2 things, 2 hours a day of outdoor time, even if they are just sitting under a tree. I know it's easy for me to say that because I live in Hawaii. So we've got beautiful sunshine all day long and you can get outside and it's not a problem. It's a lot harder in places where they've got pretty severe winters to get that time outdoors. But even a cloudy, overcast day is better. It has more lux than indoor lighting. So that's number 1. Okay. And they're just monitoring their amount of near work. Of course, you want your children to read. They have to do their homework. My 3 kids are on devices from the school for all their homework. So you can't stop that. So at least monitoring the recreational use, I think, is really important. And what you can do is just titrate it a little bit. Make sure they're taking breaks every 20 minutes where they take a little 20-second break. And then also making sure when they are on devices that they're sitting 18 to 24 inches away from their laptop or their computer or their iPad. That extra distance is going to help make sure they're not right here.
Such great practices for all of us at every age.
Yes.
I would love to know, our devices that we're using all day is emitting light, of course. Is that having any impact on our myopia or eyesight?
So this, I think, is so interesting because when we were doing distance learning, I remember my daughter coming to be like, oh, I want those special blue light glasses. Everybody's now wearing glasses, right? They could see the little pictures of all their little classmates, and all of a sudden, everybody was wearing blue light blocking glasses. It was a big thing during the pandemic. And there was this thought, well, oh, blue light is dangerous for the eyes. It's going to cause nearsightedness. Absolutely not true. The American Academy of Ophthalmology said blue light is not going to be toxic to the retina in this way. There's some studies in rats which have shown some issues with the retina, but nothing in humans. It's not been shown to cause more nearsightedness at all.
Okay.
And the sun has 100 times more blue light than your device does.
Right.
So I don't routinely recommend blue light blocking glasses. Now, for some kids who are on their devices late into the night, there's also some data that it might disrupt your circadian rhythms.
Yes.
So for them, I do say if you want to, and if your child has trouble sleeping, they had a couple studies which showed, oh, there might be a little bit more morning grogginess. Kids might not have as restful sleep for adults too. But when they did a head-to-head study in adults and looked at blue light blocking glasses and eye fatigue and eye strain, there's actually no difference.
Wow. So interesting. I could talk to you about this forever. I have some great questions from our audience, though. So if you're open to it, let's go through those.
Absolutely.
All right. Number one, is wearing contact lenses every day safe?
It is 100%. As long as you follow proper lens care. You want to always wash your hands before inserting and removing your contact lenses. You never want to sleep in them. And you don't want to stretch a contact lens. So stretching means if you are in a daily contact lens, you don't want to know the number of times where people come in for their year appointment and they say, oh, I still have 6 months supply left on my contact lenses. Well, either you're not wearing your contact lenses or they're stretching it. They're using a daily pair for day 2, day 3. And that lens material is not made to do that. It's not going to transmit oxygen as well. It's going to be a little more prone to breaks and tears, which can cause problems. So you don't want to stretch the contact lenses. You want to dispose of them when you're supposed to. If you've got a monthly lens, throw them out at the end of the month. If you're wearing a daily lens, throw them out at the end of the day. And then also being really mindful about the types of solutions that you're using, even cleaning your lens case if you're in a 2-week or monthly lens. Most people don't know they're supposed to do that. Those cases can harbor so much bacteria.
Okay. The next one is, I picked up a pair of readers at the grocery store recently, and they've been working great. My eye doctor said they're okay to use. But what are some signs that it might be time to go back in for a checkup?
So this is presbyopia, which is after 40. You need reading glasses to see up close because the lens just can't fatten and thicken and change shape the way it can when you're really young. This is totally separate from myopia or nearsightedness. Most people, when they turn that magic age of 42 or 43 or whatever it is, it'll feel like you fell off a cliff. It'll feel like, oh my gosh, all of a sudden overnight, I can't read anything. I can't read the menu unless I have my phone flash, as a flashlight. Can't read prescription bottles.
Yeah.
It's going to feel that sudden. It really will. I even had a person who went and got a CAT scan in the ER because they really thought something was wrong with their eyes. Using the drugstore readers, the Costco readers, totally fine. If you feel like I can't see anymore up close, that's time to get checked by your eye doctor.
Okay, great. How important is having polarization in sunglasses? Is it worth the extra cost?
So this depends on the individual and what you're wearing your sunglasses for. Polarization is not necessarily any healthier for the eyes than just a regular pair of sunglasses with 100% UVA, UVB. You can find that kind of sunglasses, UVA, UVB, even just at like a fashion store, at the gas station. They don't need to be expensive. I've seen them for as little as $7 or $8. Polarization just helps cut the glare. So for people who are light sensitive, people who are doing water sports, who really need a high contrast, they really like the polarization in glasses. It's not going to necessarily make your eyes any healthier or cut sunlight anymore. But I have some patients, they're blue-eyed individuals. They're so light sensitive. And, we're in Hawaii, so they're all doing water sports. Yeah. Really helps.
Amazing. I like to fall asleep watching TV. Can this cause or affect nearsightedness?
As long as you're not doing it in your contact lenses, I don't care.
Why not in your contact lenses?
Because you don't want to sleep and you fall asleep in contact lenses.
Yes.
But watching TV in general, falling asleep, people will ask me, I like to, have my head tilted. I'm lying in bed. Is it bad if I watch my iPad like that? Totally fine.
Okay. And the last question, I have 20/20 vision, but I like my computer screen at full brightness and sometimes get really close to it while working. Could this be an early sign of myopia?
probably not myopia, but of presbyopia. My kids automatically know now. I'm 49, so they know when they want me to check something on there, they go, shh, the brightness. I need that screen so bright to be able to see. And what that's doing is just makes it a lot easier for those of us of a certain age to be able to see up close. But typically it's not really a sign of nearsightedness. Okay. Up close screens, that's more of the presbyopia.
Awesome. Thank you so much for joining us today. You truly are such a wealth of knowledge. I've learned so much, and I hope that everybody listening feels a little bit more informed about their choices and options and how to keep their eye health optimal.
Thanks so much for having me.
Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe. New episodes drop every Wednesday.